Welcome students to the Unit 5, Research Tools for the Study of Spiritual Needs of Patients. In this unit, we'll deal with the methodological aspects related to the elaboration of tools used for the collection of patients' spiritual histories. Like all other units, this one is divided into 3 lectures. As you can see, in the first lecture, we'll deal with the phases of the spiritual care process by which nurses establish a therapeutic relationship with the patient. In the following lecture, we'll focus on the first phase of the spiritual care process, the assessment, where the tools for collecting spiritual histories are used. The first tools we'll consider are those that allow the collection of spiritual histories with an informal approach. In the third and last lecture, we'll explore the tools for collecting histories in a formal approach. Let's now take a closer look at what spiritual care consists of. The integration of spirituality into therapeutic practices takes place in the course of the interaction between the patient and the health care provider, in particular the nurse. Spiritual care consists of a number of fundamental steps, which are typical for the nursing process. The nursing process is understood as the sequence of steps which guide the nurse in a critical thinking, patient-centered, evidence-based, and compassionate nursing care. The approach followed in the treatment process is holistic, as it aims to take into account, in an integrated manner, the patient's overall health condition, given not only by the physical component, but also the psychological, emotional, socio-cultural, and spiritual components, in order to identify the associated problems. Needs of a spiritual nature cannot be isolated from the general condition of the patient, because these needs are influenced by the state of physical or psychological health, and in turn influence the latter. Spiritual care is, or should be, a personalized practice that will respond to the specific needs of individual patients and stems from the unique relationship between the patient and the caregiver. The process of spiritual care consists of 5 linked stages: assessment, diagnosis, planning, intervention, and evaluation. Let's now look in more detail at each of these stages. The first phase is the assessment, namely, the listening and careful observation of the patient, the exploration of religious and spiritual beliefs, and the awareness of his or her own spirituality. The acquisition of information about the patient's spirituality makes use of formal or informal tools for the collection of spiritual histories and to recognize specific spiritual problems accurately. The second phase is diagnosis, which aims at identifying spiritual needs and risk factors associated with the condition of malaise, such as loss of meaning and hope, fear, alienation, or anxiety, all of which can be traced back to a state of spiritual distress that negatively affects the patient's quality of life. The diagnosis is followed by the third stage, the planning of the nursing intervention deemed appropriate to the patient condition to meet their spiritual needs and discomforts. Spiritual care planning, as well as the subsequent intervention, should be the result of a joint interprofessional effort by a team of different specialists and healthcare providers. The fourth phase, the actual intervention, consists in communicating with the patient using an attitude of non-judgmental listening, empathy, and compassionate presence, with sensitivity and respect for the patient's dignity as a person. The nurse can encourage religious practices in the patient or creative and artistic activities to promote a condition of well-being. The nurse can collaborate with the patient's family and ask for the help of the medical team, the psychologist, the chaplain, or other religious and spiritual assistant. Finally, the nurse can encourage the patient to make use of any spaces provided in the hospital for religious practice, such as the chapel and the silence or multi-faith room. The fifth phase involves the evaluation of the effectiveness of intervention. Through a discussion within the healthcare team, the impact and effect that the spiritual care has had on the patient's therapeutic pathway is analyzed. An alternative way is to give the patient a questionnaire to collect their opinion on the effect of the treatment. An example is the Service User Recovery Evaluation Scale, an instrument from England that ensures the importance that patients assign to the spiritual care intervention. One of the major obstacles in evaluation is the elusive nature of spirituality. This characteristic inevitably implies that the evaluation by health professionals of the effect of the interventions take place, at least in part, on personal criteria, in the absence of object parameters that measure the spiritual dimension. Spiritual care, consisting of the 5 stages we have just seen, is a circular process which can be repeatedly followed by nurses. For example, if at the end of the process the healthcare team assesses that the intervention was ineffective, it's possible to go back to the first phase and carry out the assessment again in order to better capture the patient's spiritual needs and to replan a new intervention that is more effective. Ultimately, it's important to remember that the process of spiritual care can provide guidelines, but the action of nurses is part of an ongoing relationship with patients in which intuition and the human factor play a decisive role in the success of care. Last but not least, it should also be considered that one of the difficulties in providing spiritual care is that it is a time-consuming practice that the nurse carries out alongside the many other activities that engage him or her on the ward on a daily basis. The issue of time available for spiritual care is also a crucial aspect to be taken into account when choosing the tools for collecting spiritual histories, which is the focus of the next 2 lectures. On this slide, you will find some bibliographical references for further reading on lecture 1. Thank you.